You know that feeling, right? The nagging joint pain, maybe some stiffness when you reach for something, or just that dull ache keeping you up. For, well, for far too long, many of us have just accepted, oh, it's just part of getting older. But what if it's not? What if that pain, the one that's so frustrating, isn't your new normal? What if it's something completely treatable? Something can actually heal, fully heal, even if you're 60, 70, or older.
Yeah.
It's kind of surprising, but nearly 40% of people over 60 are dealing with something called bursitis, often without even knowing it. And the big problem, it gets misdiagnosed a lot. Usually is arthritis. That can lead to months, sometimes even years, of treatments that just don't work. So today on the Deep Dive, we want to cut through that confusion. We'll pinpoint what bursitis actually is, look at the causes, which are often missed, and highlight the symptoms, which are quite distinct. And here's a really good part. We'll also explore the gentle, natural ways that can bring real, lasting relief, even complete healing. This isn't just about managing pain. It's about getting your confidence back in moving so you can, garden, play with grandkids, or just sleep through the night again. Let's jump in. Okay, so let's unpack this. What exactly is bursitis, and why does it seem to pop up more as we age? Well, think of Bursae. They're these amazing, tiny gel-filled cushions. You actually have over 150 of them all through your body. They act like little protective pillows, right, between bones, tendons, muscles, making sure everything glides smoothly, no friction. Bursitis basically is just when these little cushions get inflamed, swollen, irritated. So why is this more common as we get older? It seems to be a mix of things. For starters, our bursae can naturally lose a bit of their flexibility over time, makes them easier to irritate. And we also tend to develop these compensatory movement patterns, meaning we unconsciously change how we move to avoid maybe some other ache or pain we have. But that can put weird stress on different joints, including the bursae there. Plus, tendons get less elastic, muscles might weaken if we're less active, and small injuries just take longer to heal than they used to. And certain conditions, like type 2 diabetes, can slow healing. Or carrying extra weight adds pressure, especially on hips and knees. So where does it usually show up? In seniors, the common spots are the shoulder that's subacromial bursitis, often from reaching overhead or sleeping on that side. Then the elbow, olecranon bursitis, maybe from leaning on desks or armrests. And the knee, prepatellar bursitis, sometimes called housemaid's knee, from kneeling. It's often those everyday things. I remember Sarah, 67 years old, came in with terrible hip pain, absolutely convinced it was arthritis setting in. But when we talked, turns out she loved gardening. Hours of kneeling, getting up, kneeling again. That repetitive motion was the real trigger for her hip bursitis. Subtle, the important difference.
And what's really fascinating there is just how often bursitis is mistaken for something else, especially arthritis. And this confusion, it's not just academic, it really affects how people heal or don't heal. See, arthritis usually feels more like widespread stiffness, especially bad in the morning, maybe affecting several joints, it's kind of constant. Bursitis, though, it's usually much more localized, a sharper pain that gets worse with specific movements. That pattern is a huge clue. We also need to remember the emotional side of this. When pain stops you from doing things you love, playing with the grandkids, gardening, even just reaching for a high shelf, it really takes a toll on your quality of life. So our goal isn't just less pain, it's getting that confidence back, feeling capable again. Now, from a traditional Chinese medicine view, we often see bursitis as a combination of blood stasis and dampness accumulation. Think of blood stasis as, well, sluggish circulation and blocked energy flow right in that painful area, causes that deep, achy feeling. And dampness accumulation relates more to the swelling, that feeling of heaviness or stagnation.
This perspective helps explain why just taking anti-inflammatories might only give temporary relief. We need to address the underlying energy blockage. And what's really encouraging is that seniors often respond beautifully to natural holistic treatments. They tend to be more consistent, more patient with these gentler approaches that support sustained healing.
That makes so much sense. Getting to the root cause, not just masking the symptom. Okay, so we know what it is. How can you, listening right now, start to recognize if this might be what you're dealing with? Early identification is so important for recovery. Often the symptoms in seniors start gradually, maybe a dull ache that slowly turns into more of a deep burning feeling. Let's list some key things to look out for. First, that pain pattern. It almost always gets worse with specific movements and better when you rest. So shoulder bursitis might hurt when you reach up high or try to sleep on that side. Hip bursitis often flares up climbing stairs or even just getting out of the car. Again, very different from the more constant ache of arthritis. That pattern is key. Second, you'll often find localized tenderness, meaning you can usually press gently and find one specific spot that feels really sore. That's point tenderness, a classic sign. Then there's stiffness, particularly in the morning. Your joint might feel kind of frozen when you first wake up. But here's a crucial difference for arthritis. Bursitis stiffness usually eases up pretty quickly within maybe 30 to 45 minutes of gentle movement. Arthritis stiffness can last much longer, hours sometimes. You might also notice some swelling and warmth around the joint, although this could be pretty subtle in older adults. And a big one for many people is sleep disruption. The pain often seems to get worse at night, makes it really hard to find a comfortable position, especially if it's your shoulder or hip. Now, one challenge for seniors is what we call layered symptoms. You might actually have a bit of mild arthritis and bursitis in the same joint. Or maybe the bursitis triggers muscle tension nearby, causing extra pain. This is where keeping a little pain diary can be super helpful. Just noting when the pain is worst, what movements trigger it. That helps you and your doctor figure out what's really driving the problem. I remember a patient, a woodworker, who was sure he had a pinched nerve in his shoulder. He spent months treating his neck. Turned out, shoulder bursitis, triggered by his new woodworking hobby. Once we treated the bursitis directly, all that nerve pain just disappeared.
That's a perfect example. Precision really matters. Which brings up an important point. Are there red flags? Symptoms that mean you need to see a doctor right away? Yes, absolutely. If you have a fever along with joint pain or sudden really severe swelling, or if the joint becomes hot and bright red, or you completely lose the ability to move it. Also, any numbness or tingling spreading down the limb, these could signal an infection or something else serious. Don't wait on those, get checked out immediately. It's also useful to know that symptoms in seniors often develop gradually, and they can fluctuate. Things like weather changes cold, damp days often make it worse, activity levels, stress, even how well you slept can influence the pain. From that TCM perspective again, we'd also look for other clues. Are you unusually tired? Having digestive issues? Feeling colder than normal? These might point to underlying imbalances contributing to the bursitis. And we often see what's called compensation pain. So your shoulder hurts from bursitis, you start holding it differently, and then suddenly your neck gets tight and sore. Or hip bursitis makes you change your gait slightly, and now your lower back starts acting up. It's all connected. Looking at the whole picture, your whole movement pattern is key.
Wow, yeah, how everything links together. Okay, so we've covered the what and the how to spot it. Now let's dive into the why. What are the real culprits behind bursitis in people over 60? Because understanding these causes is really your roadmap to healing and preventing it from coming back. And here's where it gets really interesting, I think. The most common trigger usually isn't one big injury. It's more often the slow accumulation of small repetitive stresses. Things our bodies handled easily when we were younger, but now, not so much. So what are these primary causes we see again and again? First, repetitive motion activities, often hobbies or chores we love. Gardening is a big one, all that kneeling, digging, reaching. Cooking or baking, especially large amounts. Crafting, knitting, quilting, woodworking, even painting or playing music. If it's repetitive, without enough breaks, it can strain those Bursae. Then there are sleep position issues. This gets overlooked a lot in seniors. Consistently sleeping on one side puts constant pressure on that hip or shoulder bursa. Ask yourself, do you often wake up sore on the same side? That could be a clue. Also, changes in activity levels. This goes both ways. Suddenly starting a new, ambitious exercise routine can overload the Bursae. But also, being inactive for a while and then suddenly increasing activity can trigger it too. They need time to adapt. Underlying health conditions definitely play a role too. Things common in seniors. Type 2 diabetes affects healing. Rheumatoid arthritis, gout, thyroid issues, they all increase the risk. Even weight changes. Extra weight means more joint pressure, obviously. But surprisingly, sudden weight loss can sometimes trigger bursitis too. Maybe because supporting muscles weaken, changing how forces distribute across the joint. And finally, we sometimes see medication side effects. Certain blood thinners might increase the risk of a small bleed into a bursa after a minor bump. Some antibiotics have been linked to tendon issues, which can affect Bursae indirectly. Let me tell you about Margaret. She was 69, came in with awful shoulder bursitis. She thought it was from helping her daughter move house. But as we talked more, it turned out she'd recently been diagnosed with prediabetes, had gained about 15 pounds, and crucially, she'd started sleeping only on her right side because of acid reflux. So the moving day wasn't the only cause. It was more like the final straw that broke the camel's back onto a foundation weakened by these other factors. And it's not just internal stuff. Environment matters too. Cold, damp weather can aggravate things. Poor lighting might make you move awkwardly. Even wearing the wrong shoes can change your gait and stress your hips or knees.
That's a great example of how it's often multifactorial. And to add another layer from that TCM viewpoint, we also think about constitutional factors. Some people just have what we call damp constitutions. They're naturally more prone to fluid retention, swelling, maybe feeling heavy.
These folks can be more susceptible. Others might have underlying blood stasis patterns, meaning their circulation isn't optimal. Again, potentially making them more vulnerable to this kind of localized inflammation and pain. And here's a really crucial insight I've seen over and over in practice. The people who heal the fastest, the seniors who get the best results, they're the ones who identify and work on multiple contributing factors. It's almost never just one thing. It's usually a combination, like that perfect storm you mentioned with Margaret. We also see psychological factors having a real impact. Things like chronic stress, grief, major life changes, retirement, loss of a loved one, health scares. These can directly affect your immune system and your body's inflammatory response. But here's the empowering part. Once you start understanding these different potential causes, sleep habits, activities, managing health conditions, stress levels, you realize many of them are things you can modify. You gain some control back. Adjusting your sleep setup, modifying how you do certain chores or hobbies, working on stress reduction, these can make a huge difference in preventing flare-ups and helping current symptoms heal. It really highlights the need for a holistic approach. We're not just trying to quiet down inflammation temporarily, we're trying to address the underlying reasons it happened in the first place to prevent it from coming back. And please, don't fall into the trap of thinking, well, I'm just getting older, I have to accept these limits. I have seen patients in their 80s completely overcome chronic bursitis by tackling these root causes and supporting their body's innate healing abilities.
That is such a powerful message. Hope and agency, absolutely. Okay, so we understand what it is. We know how to spot it. We've explored the complex causes. Now, armed with all that, what are the practical, gentle steps we can actually take? What are these natural methods that can help our bodies heal even as we age?
Absolutely. This is where you really get to be proactive. Let's talk about some key strategies for gentle, natural healing. No aggressive treatments needed here, usually. First up is mindful movement and gentle exercise. The goal isn't to push through sharp pain, definitely not. It's about restoring function, improving circulation gently. So for shoulder bursitis, that might mean really gentle pendulum swings, just letting the arm hang and swing slightly. Or slow wall slides. For hip bursitis, maybe slow, controlled leg swings while holding onto something for balance. Or very gentle stretches designed to open the hip area without straining it. Knee bursitis. Seated leg extensions with no weight or just gentle pedaling on a stationary bike can be fantastic. The absolute key is starting small, really listening to your body, stopping if it hurts sharply, and only gradually increasing the range or duration. This helps reduce that blood stasis and keeps the joint tissues healthier. Second, targeted nutrition and hydration. What you eat really can make a difference with inflammation. So trying to reduce things that tend to promote inflammation like excess sugar, lots of processed foods, unhealthy fats, and increasing foods known for their anti-inflammatory properties. Think leafy greens, colorful berries, turmeric, ginger, omega-3 rich fish like salmon or sardines, and don't forget hydration. Staying well hydrated is fundamental for all joint health. It helps flush things out, reducing that feeling of dampness or stagnation. Third, optimizing your sleep environment and positions. We talked about how sleeping wrong can trigger bursitis, so let's flip that. How can sleep help you heal? If you're a side sleeper with hip pain, try putting a pillow between your knees. It helps align your hips and takes pressure off the bursa. Got shoulder bursitis? Sleeping on your back might be better, maybe with a small, thin pillow under the sore arm for support. Or experiment with a wedge pillow to slightly elevate your upper body. And sometimes, investing in a truly supportive mattress that minimizes pressure points can be a game changer. And finally, this is huge, stress management. Chronic stress really does impact your physical body, including inflammation levels. So finding ways to manage stress is part of the healing puzzle. That could be meditation, deep breathing exercises, gentle yoga, or Tai Chi. Or simply making time for things you enjoy, spending time in nature, listening to music, engaging in relaxing hobbies. These practices help calm your nervous system, which in turn can help dial down inflammation system-wide. Healing is holistic. Your mind plays a big role.
Those are such practical, empowering steps anyone can start thinking about. Okay, as we wrap up this deep dive, the main message I really hope you take away is this. Bursitis does not have to be your new normal. We heard those inspiring stories. Maria, 73, able to get back on the floor and play with her great-granddaughter after tackling her hip bursitis naturally. Or James, 68, finally back in his beloved woodworking shop after shoulder bursitis had kept him out for nearly 8 months. These aren't miracles. They're what happens when you understand what your body needs and you give it the right support. Our bodies have an incredible capacity to heal even at 60, 70, 80, and beyond.
Exactly. So what does this all mean for you listening right now? Let's just quickly recap the key takeaways. 1, bursitis is inflammation of those little cushioning sacs, the bursae.
It's not the same as the wear and tear of arthritis. 2, it often creeps up gradually, usually linked to repetitive movements or sustained pressure, like certain sleep positions. 3, the symptoms follow specific patterns: pain worsening with movement, localized tenderness, morning stiffness that eases relatively quickly. Recognizing these helps get the right diagnosis. 4, because it's usually caused by multiple factors, a holistic approach works best. That means mindful movement, good nutrition, optimizing sleep, managing stress. And the really good news, these gentle, natural methods often work exceptionally well for seniors who commit to them. Now, of course, the essential disclaimer: please always talk to your doctor before making any big changes to your health routine or starting new treatments, especially if you have other health conditions or take medications. Getting a proper diagnosis is critical to make sure it is bursitis and not something else that needs different attention. But don't let that stop you from taking some small, empowering steps right now. Start paying closer attention. Which repetitive activities might be involved for you? Could you experiment with a different sleep position tonight if you often wake up sore? Maybe start that pain diary we mentioned, just jotting down when it hurts and what you were doing. Small, consistent changes often add up to big improvements in how you feel. Remember, aging well isn't about somehow avoiding all aches and pains. It's about understanding what's going on and not letting temporary setbacks steal your joy or limit your life. Bursitis can heal. You can feel better. You absolutely deserve to move through your days with comfort and confidence.